So you hear of colostomies before and after surgery. This is how they would appear. Then you have a visual representation of a stoma and also the type of colostomies, which we'll discuss later. It's important to note the difference between colostomy and ileostomy. Ileostomy is a stoma created in the small intestine, where colostomy it is a stoma created in the colon, and this is a picture of a normal colon. Hi everyone, for today's video we'll basically be talking about a colostomy and colostomy care. So what is a colostomy? So a colostomy is a surgery that creates a temporary or permanent opening, which is called a stoma. So a stoma is basically a pathway from the large intestine to the outside of the body, and this helps any solid waste or gases to exit the body without passing through the rectum. As these solid gases and wastes exit the body, it will go into a pouch which will collect these solid wastes and gases. So, reiterating again what the difference is between a colostomy and ileostomy. With the ileostomy, this would be a pathway from the smallest part of the intestine called the ileum to outside the body, and this will help the gases or any solid waste to exit the body through the colon or rectum. So there's many reasons why a colostomy would be needed. A colostomy would need to be when a doctor or surgeon has removed or bypassed part of the large intestine. And when this happens, the cause of this could be maybe because the large intestine either was blocked or damaged, or there's a ruptured colon that may have caused an abdominal infection, or a part of the large intestine was surgically removed. Also, some cancers may result in colostomies, or some patients needing colostomies, such as colorectal cancer or other cancers such as uterine, ovarian, prostate cancer. Now we're going to go into the types of colostomy. So first type of colostomy would be descending and sigmoid. So with these two, sigmoid colostomy is the most common type and is located in the bottom part of the large intestine. This would move waste to the rectum, and the sigmoid colostomies produce stool that is more solid and regular than other colostomies. Then you have the descending colostomy, which takes down waste to the left side of the abdomen, and the stool is usually firm because it's moved through the working parts of the colon. We also have the transverse colostomy and ascending colostomy. So transverse colostomy, the transverse colon will cross the top of the abdomen, and the stool in this area is usually soft. This is because only a small portion of the colon has absorbed water from indigested material. And there's three versions of this colostomy, the specific one, which we'll explain later. Then we have ascending colostomy, which the ascending colon runs from the beginning of the large intestine to the right side of the abdomen. In this procedure, only part of the colon still works. As a result, little water is absorbed from the waste, and this means the stool is usually liquid. And this colostomy is rare, and in this sense, or in this case, ileostomy would be more appropriate for this portion of the colon. So you have three types of colostomies. You have loop colostomy, end colostomy, and double barrel. So loop colostomy creates a stoma through which the stool exits, and in this type, the colon will stay connected to the rectum. And as a result, people will sometimes pass stool or gas through the rectum. In a single barrel colostomy, the surgery removes the colon below the colostomy, and including the rectum and anal opening, and this colostomy is permanent. As well as double barrel divides the colon into two ends that form two separate stomas, and the stool exits from one of the stomas, and mucus exits from the other. This type of transverse colostomy is the least common, so it doesn't happen quite often as the others. So when it comes to colostomy care, you will have a pouch. So you'll have to empty this pouch. So when emptying a colostomy bag, after surgery you'll have the bag, and when you have this bag, you're not able to control all the stool and gas that is being passed into the pouch. So you should empty the bag when it's about a third or halfway full. This is my best visual representation of a colostomy bag. So when it's about a third or halfway full, that's when you should empty it, and also about like several times a day. And when you empty it, make sure as you're about to take off the pouch, you're prepared for the smell, because it is stool and gases that are just trapped in the pouch. So you need to make sure that you're okay with the smell. So a lot of people use masks or sometimes put vapor rub to try and mask the smell of the pouch. So when it comes to caring for the skin, which is the peristomal skin which surrounds the stoma, as we can see, we would first begin by cleaning the surrounding area by using a washcloth and using warm clean water to clean around the area. Try not to use any soaps or lotions to clean. Soaps or lotions with alcohol to clean around the area, and be gentle as you clean. Then you would proceed to see if the patient is shaved. If the patient is not shaved, you need to trim or either shave the surrounding hairs around the stoma, which will make it easier. Then you'd begin by patting it dry to make sure that when you put the bag back on, it will stick properly. Generally to patients, the stoma is not painful to clean or sensitive, but if it is sensitive, then the stoma may be infected or irritated. So it's important to take notice of that as well. So if there's redness around the stoma, this may indicate that there may be an infection happening or sensitivity.